Hey there, YouTube fans. How you going? I got a couple of words. The first words that come to mind is pièce de résistance. I found it. I found Eureka. I found the missing link in me for at least 25 years, something like that. Listen to this. And this article is Critical Case Reports. It's Iron Deficiency Without Anemia, a Clinical Challenge by Esa T. Sopi. It's a Finnish journal, Helsinki, outpatient clinic, ERA hospital. And as I said, the title is Iron Deficiency Without Anemia, a Clinical Challenge. Finland, okay? Sopi, S-O-P-P-I. Long story short, when a patient had IV iron, after a few weeks, they felt better. As soon as they stopped it after I think it was a few months, a few weeks, there's a chart here, and it's not important how long after they stopped it. Then all their symptoms came back. Then they got on it again, and they improved. They felt great, and they stopped it, and all their symptoms come back. They didn't have any response with oral iron tablets. So that's something very important. It has to be monitored. But the ferritin levels that they give you for people that have this kind of chronic iron problems, anemia, iron deficiency, is not high enough in the reference ranges for some people, especially if you have inflammation. And here is why I'm going pièce de résistance. What I found amazing, hallelujah, is he says, if symptoms are in accordance with iron deficiency, the patient should be considered iron deficient at least up to a serum ferritin concentration of 100, I think it's milligrams per liter. It's the little mg symbol. I'm not sure what that means, but at least 100. I think it's mg. I'm not sure how to explain that medically. Or even much higher. If the patient has an inflammatory condition, kidney disease, or fatty liver. Iron deficiency, irrespective of manifestation, should always be treated. Guess what? When I was 26 years old, and we're talking 24 years ago, I was diagnosed with fatty liver, and I've had that problem ever since. I still have it. This fatty liver messes with your iron absorption. That's one of the things, not including the other things that I've got, but just one. Fatty liver is enough to cause chronic deficiency of iron and possibly even anemia. Anemia of chronic inflammation is probably what it is. Anemia of chronic disease is what they used to call it in the old days. They changed the definition. That was the other thing. I had a look in the mirror and look at my eye conjunctiva now. I don't know if you can see, there's actually color red in there now. This is after iron infusion. Now, before, it was white. Like 50% of it, closest to the eyeball, was white. Now there's actually color in there. My mum used to do that to me all the time, the old Sicilian way, Go and look into the old eyeball and see if you're anemic. Dear mummy, you are right. You are absolutely right. After iron infusion, I mean, it still hasn't caught up with me systemically very much yet. It's going to take time. But even in my eyes, the red has come back. The red has come back to my face, I noticed today. I noticed on the videos. Those are a couple of things. But the absolute miracle thing here, don't trust the lab values. They can be too low. They can be too low. If you've got fatty liver, you got to have at least over 100 for ferritin, serum ferritin concentration. Okay? Hope that helps somebody. Always check with your doctor. I'm not your doctor. Please remember to like, comment, and subscribe. Peace out. Ciao.